This is Health 54 right here on your digital first Pan-African News Network TOS Television. I am Rose Audu. Just 54 days into the year 2022, a report by Worldometer has shown that at least 45,318 women died during childbirth. According to the reference website, as at Thursday, February 24, over 442 mothers have died during childbirth. The World Health Organization says women die as a result of complications during and following pregnancy and childbirth. WHO says while most of these complications develop during pregnancy, most are preventable or treatable. The Global Health Body noted that the high number of maternal deaths in some areas of the world reflects inequalities in access to quality health services and highlights the gap between rich and poor. The National Agency for the Control of AIDS says that no fewer than 1.7 million patients accessed HIV and AIDS treatment in the Southeast region in 2021. NACA's Southeast Zonal Coordinator Dr. Marian Ezekwe disclosed this at a stakeholders coordination meeting in Oka on Thursday. Ezekwe stated that such epidemic control was achieved in the region following effective policy implementation, resources allocation and actions taken by stakeholders. Britain on Thursday pledged an extra £160 million to boost global vaccine development with the aim of being able to produce a global shot within 100 days of any future pandemic. The money will be on top of the £276 million that Britain has already given to the Coalition for Epidemic Preparedness Innovation, a global partnership launched in 2017 to develop vaccines to stop future outbreaks. And the World Health Organization has said the newly recorded wild poliovirus case in Malawi was imported. The WHO Regional Immunization Advisor for Africa, Richard Mihigo, made this known on Thursday while addressing journalists at Area 2 Primary Health Care Center in Abuja. Mihigo said polio is not an indigenous virus that was circulating in the country at the time. He said the imported case was promptly detected due to good quality surveillance system in the country. And the World Health Organization, WHO again, has announced 5 additional countries that have gotten approval to begin vaccine production locally. These countries are Bangladesh, Indonesia, Pakistan, Serbia, and Vietnam. This is coming a few days after 6 African countries, including Nigeria, were selected by the global body to receive the technology needed to produce mRNA vaccines. This is TOS Television Network, and you're watching Health 54. More stories, including Nigeria's COVID-19 update when we return. To stay with us. Welcome back. In a renewed move to ensure the safety of the Nigerian environmental health space, the Minister of Environment, Sharon Ikeazo, has launched the Professional Regulatory Instrument for the Guide of Environmental Health Officers Registration Council of Nigeria. Ikeazo, who was represented by the Permanent Secretary of the Ministry, Engineer Hassan Musa, said the Professional Regulatory Instrument was to minimize environmental health risk in the country. The minister emphasized that prevention remains the best measure to combat outbreaks and stood two of the recommendations to be better than cure, hence the importance of guidelines that would be used to work and will prevent health risk. And the House of Representatives has urged the federal government to overhaul the operations of the Port Health Services and equip it to a world-class standard. The House also urged the National Primary Healthcare Development Agency to work towards creating the required synergy between its vaccine operations and the Port Health Services to ensure online real-time access to vaccination records of travelers from the database provided for such purpose. And the body of late Dr. Paul Farmer, founder of University of Global Health Equity and co-founder of Partners in Health, was on Thursday, February 24, repatriated to his native United States following a private final farewell ceremony that was held in Kigali. President Paul Kagame, alongside First Lady Jeanette Kagame, joined his widow, Didi Bertrand Farmer, and family as well as friends and colleagues of the deceased to grieve the immeasurable global impact of his life. Farmer, described by many around the world as a global health icon, breathed his last early this week on February 21 peacefully in his bed, according to a tribute. And Delta State Commissioner for Information Charles Inyagu has said that persons living with HIV and AIDS in the state would benefit from the government's empowerment programs. Inyagu disclosed this on Monday when the zonal coordinator, National Agency for the Control of AIDS, Udwak Daniel, led his team as a courtesy visit to Asaba. It is reported that the Executive Secretary, Delta State Agency for the Control of AIDS, John Osuyali, and Head Prevention and Communication Unit, Delta State Ihiaka Ezeme, were part of the team. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.